Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Duke in here with us this afternoon, and Duke found us on YouTube, like a lot of people do, and he's got some headaches at the base of his skull that go around onto the top and into the temporal region, so we call that occipital, temporal, and parietal headaches. And we're going to find out what kind of headaches and help him out with those. So first thing I'm going to do, Duke, is have you close your eyes and bend your head forward and backwards for me. Now I've already done the orthopedic neurological test on Duke. Now backward all the way. That kinks up a little bit right there, doesn't it?
Yeah.
Yep. Now, in his posture, you can see his whole head's way forward. His ear's dropping right here over his clavicle is where it's supposed to be back here over his shoulders. And you can see that because his hands are out in front of him here too, as opposed to having his shoulders squared off and his hands being at his sides here. And his head's forward. He's starting to get a little bump right here. A lot of people call that dowager's hump. You ever seen older people with that hump right there? We're going to make sure you don't get that. You're too young for that.
Oh, okay.
Yeah. Okay. So again, like I said, we've already done a couple of tests, but I want to show you one that tells me exactly what we want to do. Sit right here for me again. Now see, when I compress him, that causes pain in his lower neck and upper back, and when I go backwards and to the right, that means even worse, huh?
Yeah.
And then backwards and left, that hurts in the lower cervical, upper thoracic spine as well. But when I do this, that makes it feel better, right, dude?
Yes.
So we know that he is compressed, and that's where he's getting the compression of the occiput, which is the skull, on C1, which is the first vertebrae in the neck. So we're going to decompress him very first thing. Duke, I'm going to have you come over here and lie on this table. Pelvis right here, legs down there, please. Now, he probably has seen this on our YouTube videos, right, Duke?
Yes.
Yeah. And most people know instinctively this is what they need. Slide up that way a little bit. Did you think that when you watched it, that's exactly what I need?
Yes.
Let's slide up a little bit more. Straight up. That way. There you go. About another inch. That's it. So we get his pelvis even with that steel bar down there, so when I stick these pins in there, we will be able to stabilize his iliac crest on both sides. Now, I looked at his x-rays also before we got started, and he does have a loss of the normal cervical lordosis, which is the forward curve in the neck. Now, those are going to feel real tight, Duke. Push yourself away to make sure you don't slide through. No, push away. Push up. Are you in there tight?
Yeah, I'm okay.
You're not going to get away? Okay. So, what I'm doing here is I am going to wrap this around his occiput back here, and that's where I get my main contact in his jaw. Keep your teeth closed, Duke. Take a deep breath in. Let all your air out. There you go. Now, do you feel that open that up right up there?
Wow.
Do you feel that all the way down?
Yes.
That's Duke's very first spinal decompression manually, and he did great. Just lay back there and relax. Okay, so now I know he's got vertebrae misaligned in his C1, C2 area. There we go. I know not to talk when I'm adjusting those crack addicts. You get mad at me when I do that. We like to have fun in here too, Duke.
Yes. I enjoyed it.
Yeah, that's good. Okay, let's have you come over here and lay on your tummy on this next one. Your headache should be gone by the time you leave our office today.
Oh, okay. That's good.
So if you're suffering from headaches out there,
Face down.
chiropractic is a great treatment for headaches, and especially what we do with the spinal decompression. Now his right leg is about 1/8 of an inch short, not bad. We lift his legs up and they get even. I bet you that tightens up a little bit in your lower back, doesn't it?
Yes.
Yep. So his pelvis is off just a little bit right here in the sacroiliac joints. And then right there at L5, that little tender right there, Duke?
Yes.
Okay, so I'm going to adjust his right SI first. There. That's it. And then we're going to adjust his left sacroiliac. And you notice I'm adjusting those at 45-degree angles. and then his sacrum straight superior to inferior on the y-axis to get it away from L5. L5 right here is straight P to A or posterior to anterior in the z-axis. L4, you notice the angle in my arms changing as I move up the spine because the joints change their alignment as you go up higher. There, good. Okay, now just breathe normal. And exhale. Yeah, that's it. That's perfect. Good job. Okay, I'm going to put your head down just a little bit to open these joints up. And exhale. That's it. Good job. That's it. Perfect. I still got one right here. There it is. Yep, that was it. Okay, now we're going to recheck his leg length, and now they're exactly even. I bet you this feels a little easier this time, doesn't it, Duke?
Yes.
Okay, good. See, his pelvis didn't raise way up off the table that time. So, Duke, I'm going to do some deep tissue work on you now. Just lay there and breathe. YouTube fans, y'all know this as the Turbinator. For all you new people, yes, this is a Black & Decker jigsaw that I had retooled and made into a deep myofascial release instrument. And yes, it is a Black & Decker tool. Everybody say, I always see, oh, that's just a Black & Decker drill. No kidding. I've only said that 50 times. There we go. Since sacrum's out a little bit still, there we go. Now, this time coming up, Duke, this should feel even easier. Did that feel a little better that time?
Yes.
Did that hurt your low back at all?
No.
Okay, good. Okay, now I'm going to be nice to Duke. He's brand new today, his first visit ever here. Have you seen chiropractors before, Duke?
Yes, one time.
Okay, good. I always like people that have seen other chiropractors. That way they know the difference in what we do here versus what they've had before. You notice I don't put a lot of people on their sides and twist their low backs or their pelvises on the side posture. Sometimes I'll do that, but I don't do it very often. And listen closely, because I have to say this one over and over too. It creates ligamentous instability if you do that too much, and then you have to want to kind of crack your back all the time, because you need to get that cavitation or that pop fix for all you crack addicts. You gotta want to crack your own back and neck all the time, and that creates ligamentous instability, which makes you more unstable in your spinal biomechanics and will cause you more back pain over the long run. And we got the blinds open for all you today. You like the view we have, beautiful downtown. Galleria. We've got great view from where we are here on the 10th floor. We're in Suite 1060 at 363 North Sam Houston Parkway East in North Houston. We're only about 10 to 15 minutes away from George Bush Intercontinental Airport, call sign IAH. And we have a special deal with the High Regency across the street for rooms for $129 a night, aren't they?
Yes, sir.
Compared to what, $250?
$250.
Yeah, a night. So we give you quite a bit of savings if you're coming in from out of state or out of the country. And then our patients just walk across the street and see us. Come up to the 10th floor, Suite 1060. Everybody usually gives me about 3 hours to stop this dude. Great. Good job. Okie doke. So, now Duke's had a little bit of some sinus issues and some problems with his TMJ area. Not really his TMJ joint, but in the area of his frontal sinus. So I'm going to have you lay on your back for me now, Duke. So I'm just going to do some techniques on his sinuses. Take a deep breath through your nose. And exhale through your mouth. There you go. Tender right there, huh? Another deep breath through your nose. And out through your mouth. Now where he gets most of his pressure is right up here in his sphenoid sinuses and frontals. Okay, another deep breath through your nose. I'm applying some really direct, deep pressure in here. Okay, another deep breath in. Now he has headaches 24/7. 24 hours a day, 7 days a week. So I'm checking his temporal suture as we're doing this. Do you feel all the knots on this right side there, Duke?
Yes.
Like right there, for instance? Do you feel like that's where you get a lot of your soreness when you have your headaches too? And those, or do you notice that?
I don't notice.
Don't notice those that much? Yeah. See the little knots all the way through there?
Yeah.
That contributes to your... Sometimes he wakes up in the middle of the night and has some breathing issues where his breathing just kind of stops and it kind of alarms him and he wakes up, so it interrupts his sleep. Now one more deep breath through your nose. Excellent. Okay, you can relax. So I'm rechecking his cervical spine right now, and it's feeling pretty symmetrical from side to side, but he still has just a little bit of paraspinal muscle hypertonicity right down here at C5, C6, which on his x-rays he actually has degenerative disc at C5, C6. So I'm applying some deep pressure right down here in his paraspinal musculature. I call this the corkscrew move. That's tender right there, huh?
Yeah.
Keep breathing. There you go. This is one of those hurt so good treatments. He's probably not thinking that right now. He's probably just thinking hurt. But it'll be a lot better. He should leave here without his headache today. Excellent. Good. Okay, let's sit you up and face towards Joseph there out the window. Okay. See, we got a great view of downtown. You see that?
Yes.
Galleria right over there. There we go. That's the right glenohumeral joint. And now, the left glenohumeral joint. The right one was out worse than the left one today. And I'm just going to check his elbows and his wrist, hands and fingers. We're going to get the entire pathway of his nerve process from his neck down to his extremities, because he has had some achy pain, numbness, and tingling in his arms and hands and fingers. Sometimes that can be from nerve pressure right here in the carpal tunnel. Sometimes it can be up here in the brachial plexus. If you have it both places, it's called double crush syndrome. Perfect. All right, let's stand up right here in front of the mirror again. And now I'm going to shoot you. So, this is what this feels like, Duke. It's just a little tap. I'm going to have you close your eyes again and bend your head forward and backwards and remember how this feels. He's already got better range of motion back to neutral. Normal. Okay, so take a look. See, you're not as far forward now. Look where your arms are now compared to where they were before. But here's your homework right here. You're going to lift up with your traps. You're going to pull back simultaneously with your rhomboids. Flare these back like this. See how that tightens up your whole trap there?
Yes.
Now you got to be careful on this not to jut your head forward, because what we're really going to do is we're going to bring it straight back like this, and because you're a little bit to the right, we're going to go exactly a mirror image of that and look up to the ceiling now. You're going to feel a little tap right under your skull here, another little tap right under your skull here, and I'm adjusting the atlas right now on the x-axis, resetting his trap muscle spindles and rhomboids, okay? Now, this time when you go forward and backwards with your eyes closed, Duke, this should feel smoother. Tell me and see. Back to normal. Yep, look at you right down the middle now. And see, you got equal spacing down here now. Your hands are more at your sides than they were when you walked in. Do you still have a headache?
I feel much lighter.
Lighter? This, compared to 7, it's a what? 1 or 2? 3?
2.
Yeah, 2. Okay, so a lot of times headaches will go away completely. His went down from a 7 down to a 2, so that's pretty good for the first visit. Is there anything else?
Look forward to see you again.
Look forward to seeing you again too. Thank you for sharing your story with others.
Thank you.
And this year, Houston chiropractor Dr. Gregory Johnson with Duke here at Advanced Chiropractic Relief in Houston, Texas. We'll see you next time.